Food is obviously fundamental for all of us, so if you want to create a more equitable country, what better place to start than access to nutritious food, right? Well, here now to discuss that, Kathryn Scharf. She is Chief Operating Officer of Community Food Centres Canada. And it's nice to have you here at TVO.
Thank you.
Before we talk about Community Food Centres Canada, I want to just ask you about the Stop, because the Stop is a pretty well-known place in Ontario's capital city, but maybe not beyond. So just start by telling us what the Stop is.
Sure. Yeah, I worked there myself from 2006. The Stop is basically it's a community center built around food. It started 30 plus years ago as pretty much a basic food bank, just giving out food like others, founded to address the emergency of one of the first big recessions of the 80s, and after a number of years started to expand and look at more holistic programming that could meet a broader variety of needs for people, from health to skill building to community engagement.
So it's way beyond a food bank now.
It's way beyond a food bank, yeah.
And Community Food Centres Canada emerged out of that? Is that what happened?
That's right. The Stop is the founding partner of Community Food Centres Canada. It birthed us, and we went out on our own in 2012. The executive director and myself, I'd been the program director, and we founded the organization to go national and to look at what it would take to scale and replicate the model that had been developed at the Stop.
And do you do the same stuff the Stop used to do?
A version of it, a smaller version. Often we're founding new centers across the country, so it's a pretty big organization, and they tend to be smaller, maybe 5 staff versus the Stop's got maybe 30 staff now. But 5 we felt was kind of the critical mass, and we've got about 8 partners now, including them across the country, from Calgary to Dartmouth and Winnipeg, and Regent Park as well here in Toronto. So.
Tell me about whether or not the Community Food Centres Canada does is it the same type of sort of multi-sectoral approach that the Stop used to do? It's more than just a food bank?
Exactly.
Yep.
So that was when we looked at the model and we thought, what is it about this that is transferable to other communities? We tried to isolate what those factors were, what those things were, because we knew that every community is different and that you're going to have to respond to local needs and look at local demographics and what the gaps in services are. But there were some things that were kind of that were essential to the model. And those were the multidimensional approach itself. So meeting the basic needs around possibly a food bank, that we don't start new ones, but we often work with the ones that are existing. So meeting a basic need through a food bank or a healthy meal program. And then once people are in the door for that, they'll often want to get involved in some of the other programs that are there, like a skill building program, after school programs for kids, a market that's run by the community that increases access to healthy food. So again, it depends on the community exactly what the programs are that emerge, but they tend to fall into those areas of access, skills, and then civic engagement, getting involved around the issues, because that's what we're trying to do as well.
Do some of your organizations grow their own food?
They do. They're not production facilities or farms, right? I mean, most of the community food center often has a garden attached to it, a community garden in a nearby park, or maybe even right on the site. But it's really more about the pleasure and the education and the knowledge and the community building that comes from the garden than producing food on scale.
Gotcha. And how many food centers you got open now?
Well, we've got 6 open and 2 that we hope to launch this year.
And how do you fund them?
Well, we raise money. We ask people for money and they give it to us. So far, we've raised about $15 million since we launched in 2012. So
$15 million?
$15 million to help fund the centers. And then our partners that we work with locally, because they're organizations of their own, they also bring part of the funding to the table when they raise it themselves.
Do you get government grants?
We have had support from Public Health Agency of Canada and in Ontario through health. So, yep, we do.
But also private sources as well?
A lot of major donors and corporate support. We hustle for money. We have events. Who's our biggest donor? Sprott Foundation is a
Sprott Foundation?
Yeah,
how much do they give?
They gave us $5 million of that 15. So
that's not bad at all.
No.
Okay, let's talk about food insecurity in Canada, because I gather that's that's what it's called now, food insecurity.
Food insecurity.
Is there a definition of what that means, actually?
Yeah, I mean, I think that's been driven, that change in part. It sounds a bit foreign to people, but it's been driven by the idea that hunger doesn't capture the full scope of the problem. If you say, are you hungry, it means one type of a thing, and it's very hard, it's a very subjective sensation. But food security goes far beyond that to measure everything from mild food insecurity, which is defined as the worry that you won't be able to put food on the table, to the actual missing of meals for a day or more. So it's defined as moderate and all the way to severe. So by that measure, by the full measure, there's 4 million Canadians that are food insecure. And also in the past, people have used food bank usage as a proxy for hunger, but that doesn't fully capture the problem either, because we now know that probably only a quarter of the people who might want to use or might need to use a food bank actually do.
So you're saying more than 10% of the people in this country either don't know where their next meal is coming from or fear that their life is so precarious they might be in that soup. To use a bad metaphor there.
Yeah.
Huh. Okay. I think it's fair to say that most people probably think of this as a kind of big city phenomenon.
Yeah.
But I note you've got a food center open in Stratford, Ontario,
Yeah.
in Perth, Ontario. Yeah. Does food insecurity look different in a smaller place as opposed to the big city?
It doesn't. I mean, it's it's people who live in that town that looks different. So the demographics of that town are the ones that are the people who are food insecure there. But it can be worse. Though we have a great deal of concentration of poverty and food insecurity in Toronto, we also have a lot of services that people can access, and a lot of social service agencies, and things are closer together.
That they may not have in rural Ontario.
In Perth, they don't even have a transit system. So if you're outside of town, it's pretty hard to get around to access what services there are, and there just aren't that many because there isn't the population base or the funding base to support them.
Let's just, again, we're doing sort of food security 101 here, so let's get the obvious stuff on the table off the top. If you're a low-income person, fair to say that one of the first things that takes a hit is your ability to purchase nutritional food?
Absolutely. Yeah, I mean, some of the statistics that you may be aware of or have read about, even in the last few weeks, they were talking about, if you recall, the infamous welfare diet that Dave Civic was proposing people could live on under the Harris government when they were cutting first and then freezing the rates. That has, the cost of that has now, even that meager diet is now $200 a month. A single person on welfare gets about $680 a month. So if you take into account the fact that a one bedroom, or not even a one bedroom, let's just say you're sharing a room, a typical bachelor is about $900 now in Toronto, and even sharing, let's say you're sharing with somebody else, that's still going to be what, $500 or $600 at the cheapest price that you can get. So compare the $500 to the $680 you're getting, and you can see that all the rest of that money, that's to cover everything. So what's the first thing that's going to go? It's going to be food, right? And what's that going to do to your well-being and your health? You're going to have to go visit a food bank potentially, or a meal program, and depending on what you get there, you may or may not feel diminished by the experience, because people do actually find it very difficult to go and accept charity, which may explain why only a quarter of people do.
So that's still, I mean, food banks have been around for 30 years now, right? Maybe even more.
Yeah, more.
Do you still find it the case that there are some people who will not access a food bank because they don't want to be seen there?
That's what the research is showing. Again, we don't know for sure why they don't access a food bank. It may also be because the food bank's not open. They vary so widely. We've put so much emphasis on the food bank as the way we're going to catch up some of the frayed threads in our safety net. Yet, they're not funded in any kind of a consistent way. And so therefore the quality ranges wildly from place to place. Some of them are very well run, very respectful, have pretty good food. Others may not have the capacity. They may try hard, but they're maybe open one day a week for a couple hours. If you miss that, if you're working poor, then you're not going to go to that food bank. So
or you haven't got a car and you can't get there, or there's no transit, whatever, all that stuff,
yeah.
Right. Again, out of the, this may be obvious department, but let's ask anyway. If you are routinely skipping meals because you can't afford to buy enough food, or if you are eating, for lack of a better expression, crap because you can't afford good nutritional food, what does that do to your long-term health prospects?
Well, I think we increasingly understand what it does. The research shows that, we have across all classes in our society, we have a huge diet problem. We have huge rates of diet-related disease, from cardiovascular disease to cancer. And low-income people are no different, but it's worse for them because they don't have access. They can't buy good food, and they are dependent on what they can get at the food bank or what they can afford in the store. So we know that they have higher rates of diabetes and all diet-related disease. So that's just another way in which being poor is really difficult, and it's really unfair.
And the future looks like one where food is going to be more expensive. So
That's true.
presumably, I mean, the future is worse for people in terms of food insecurity, is it not?
That is possibly the case because all of people who live on social assistance, and they do make up a large percentage of those who are, say, using food banks or who are poor, they don't have any, nobody's calculating the rates relative to the cost of living. So if food goes up, welfare doesn't go up in the way that it's currently structured. So yes, they will suffer more. And the ironic thing is that we actually have very cheap food in our society. We pay less as a percentage of our income for our food than many, many countries do. So it really isn't the problem with the cost of food.
I can introduce you to some farmers who are not that happy about that too, you know.
Yeah. So the problem is that people don't have enough money to buy food. So that begs the question of, we have to look at the larger social policies that, we're working at the grassroots to use food to as much as possible to increase health and to be a source of joy and connection to community, but we can't do it in the same way that food banks can't fix it by giving out food. We can't fix it through community programs either. We need to have social policy. We should probably be looking at a basic income, which is on the table a lot these days, seeming to bubble up from a variety of social problems and sectors.
You're a downstream solution, right? But what you're looking for is an upstream solution, if
yeah,
I understand
we're midstream.
all that.
I'd like to say we're midstream. We're
Okay.
building rafts, in the midstream. Upstream there, I believe the metaphor is that they're throwing the babies in, and then downstream they're rescuing them and pulling them out. That might be more the food bank. We like to think we're kind of in the middle, building lifeboats.
But it's better. Okay, I like your metaphor, but clearly it's a better idea if you can tackle a problem upstream before it gets downstream. So,
Absolutely.
and you think an upstream solution might be a guaranteed annual income, for example.
That is one. Food is a complex issue, and there's so many aspects to it, and food and health and food security includes agricultural issues and the ability to produce food locally. So it is complicated, and food can be an interesting lens to kind of look at across silos and government departments and so on. But yes, it's fair to say we need an upstream solution.
Let me ask you about volunteers, because I presume some people who use your food centers also volunteer there as well. Does that happen?
Absolutely. It's actually kind of a fundamental piece of what we do. So whereas some in the past, and it's not true across all food banks, but some actually prohibit people who receive food from volunteering. And we kind of are the reverse. We don't compel people to volunteer, but we ask the centers to aim for at least 50% of the volunteers, of people who are actually using the programs, to try and recruit people and to make them feel that they have some input and ownership and all of the skills and the value that can come from giving back.
So there's a kind of a civic engagement angle to what you do as well?
Oh, absolutely. And there are programs that capture that even more to try and get people really working on the issues of poverty and food insecurity from the grassroots as well.
And these food centers, there's community space for people who want to do other things there as well? Is that right?
The cooking. There's always a kitchen. There's usually a garden attached. There's lots of cooking programs, and then often healthy meal programs in a big dining space where people can have a public meeting if they want to. Invite, as they did in Regent Park, the mayoral candidates to speak, or just have the big meal program, a seniors lunch, whatever it may be.
Why do you think that's important to do?
The mayoral candidate or
the
whole
whole note. Well,
debate?
it's always good to have mayoral debates wherever you go. We had one here.
Yeah.
But no, the bigger piece of
well,
community
again, this is
involvement.
across our society that people are becoming more and more isolated and just in their homes. And this is, as a middle income person or a higher income group, you can go out for dinner. You can have your friends over for dinner. You can do all sorts. You can go to the farmer's market. Poor people don't have that option. So there aren't that many free places you can go and do fun things, and food is such a source of pleasure and connection. Barriers come down around food, people when they're cooking together, when they're eating together. So it's just a really obvious way that you can build community and create a kind of public space that people can access.
It's interesting because if you can afford it, food can be a great social experience. It can be a wonderful culinary experience, obviously.
Yeah.
But if you can't, it must be a source of constant angst. Right?
That's the thing. It can be, as you say, a very stressful. There are well-documented effects on people's mental health from that constant stress that we talked about, of not having enough food. And then it can be a very, wonderful thing to have access to good food and to be able to use it to bring your family together, to bring your friends together, to know you can feed your children a good, healthy meal.
Well, thanks to you, we know a little more about it right now. So thanks for coming into TVO tonight.
Thank you.
Kathryn Scharf, Community Food Centers Canada.
Help TVO create a better world through the power of learning. Visit supporttvo.org and make a tax-deductible donation today.